Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk. Hoosiers aged 60 to 65 will soon be able to receive the COVID-19 vaccine, but the state still has no plans for teachers and other essential workers to get the shot.
The goal is to ensure that we have all of these second doses covered before expanding further.
African Americans are receiving the vaccine at a lower rate than the rest of the population. Much of that can be traced to distrust in medicine dating back decades.
So we have a huge pandemic out here right now that has actually drawn attention to what has not happened over the past 20-something odd years. So it's right here in our face. So what are we going to do?
And the latest on what bills are and aren't moving through the legislature at the Indiana State House, including a measure that would eliminate the requirement to have the license before buying a handgun. Those stories and the latest news headlines from around the state right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Indiana plans to reduce the age of eligibility to receive the COVID-19 vaccine to 60 years old as soon as possible. But as Pat Bean reports, health officials are drawing the line there until supplies of the vaccine increase.
So you can just go.
While Indiana announced this week the state will lower the age to get the COVID-19 vaccine to 60-year-olds as soon as possible, there are no plans to vaccinate teachers and other essential workers. That's because Indiana has an age-based approach and supplies of the vaccine remain limited. Indiana is receiving about 100,000 doses of the vaccine a week.
Vaccinating Hoosiers aged 60 and older targets a population that accounts for 93% of the deaths here in Indiana.
The 60 to 65-year-old age group includes more than 400,000 people. Once that group is vaccinated, the state's next step will be to lower the minimum age to 50 and include persons under 50 with 5 specific comorbidities that make COVID-19 more deadly. These are patients on dialysis, with sickle cell, with Down syndrome, patients who have received post-solid organ transplants, and people in treatment for certain cancers.
We know that these categories do not include all Hoosiers who have conditions that could put them at greater risk from COVID, but we are working to expand to those most at risk as quickly as our vaccine supplies allow us to do so.
The age-based approach to vaccinations goes against CDC guidelines which place teachers, grocery store and public transit workers, and others ahead of anyone under 75 years old.
The way that we're scheduling appointments here is accommodating both the consumer, the person wanting to get it in their arm, and our supply.
So far, almost 750,000 Hoosiers have received the vaccination. A third of those have received both doses. There are 6.7 million people in Indiana. This week, the state passed 12,000 COVID-19 deaths, including nearly 2,000 in January. These contributed to an 18% jump in expected deaths in the state last year. For Indiana Newsdesk, I'm Pat Bean.
But Indiana's rates of new COVID-19 infections, hospitalizations, and deaths continue to decline since peaking in early December. And state health officials this week lowered the risk level for COVID-19 spread in more counties. Only Switzerland County in far southeastern Indiana is in the highest risk red category. About 2/3 of the state was in that category a month ago. Data from the Indiana State Department of Health reveals a lower proportion of Black Hoosiers are choosing to get the COVID-19 vaccine. Experts say that hesitancy is valid and is a symptom of systemic racism. Brock Turner reports.
Data shows Black Americans are more likely to be exposed to COVID-19 from their workplaces, and another study from the University of Minnesota found that Black, Hispanic, and other racial minorities were more likely to be hospitalized after contracting the virus. While Black and African American people make up nearly 10% of Indiana's population, the demographic only accounts for 4% of total vaccines administered. Statistics like these aren't surprising to Tara Morris, who heads the Minority Health Coalition of Elkhart County, but they do create a sense of urgency.
We are so far behind in addressing what's in front of us when we look at these health disparities. So we have a huge pandemic out here right now that has actually drawn attention to what has not happened over the past 20-some years. So it's right here in our face. So what are we going to do?
Tony Gillespie, the Vice President of Public Policy and Engagement at Indiana's Minority Health Coalition, agrees.
You can't address 100 years of mistrust of public health and healthcare, period. You can't address that in a webinar.
For Gillespie, much of the distrust stems from historical events that have eroded it within the Black community. He says the decades-long unethical medical research in Tuskegee, Alabama, drove a wedge in the community that's been difficult to repair. Those and other systemic barriers make it more difficult for Black and other minority populations to trust public health officials and health systems that care for them. But stories that foster distrust are both recent and local. Late last year, a Black Indianapolis physician, Dr. Susan Moore, published a series of posts and a video lying in her bed in an Indiana University Health hospital, describing how she was treated by a white doctor. 2 weeks after posting the video, she died. On Christmas Eve, IU Health's president, Dennis Murphy, issued a statement ensuring it would conduct an outside review, but defended the care Dr. Moore received, saying in part, quote, "I am fully confident in our medical team and their expertise to treat complex medical cases. I do not believe that we failed the technical aspects of delivery of Dr. Moore's care. I am concerned, however, that we may not have shown the level of compassion and respect we strive for in understanding what matters most to patients." Gillespie recognizes examples like these reinforce distrust, especially with a new vaccine.
Healthcare is a big decision, and a vaccine that didn't exist before a few months ago is the biggest thing that's going to happen in our lifetime.
Dr. Clyde Posley, a pastor at Antioch Missionary Baptist Church in Indianapolis, had similar concerns. He knows firsthand how severe this virus can be.
My 95-year-old father, I preached his funeral 6 weeks ago. He was walking and healthy and joking on Thanksgiving. By the Saturday following that Thanksgiving, he was dead, and he died alone. None of his 4 children could live, remaining children, none of us could go see him. I'm his pastor. I couldn't see him in the hospital. The next time I saw my father was in a pine box. And so that is a reality. So something has to be done.
That's why, after reading up on clinical trials and conducting his own research, Posley began advocating for his congregation and those in the community to receive their shots.
This is what we need to do, and we need to hit it. We can't simply talk about it. We've wasted whatever a person's political views are. We did not attack this COVID the way we needed to. And so we need to attack it the way we need to now. And so if the Lord were to call me home today, I want to go home knowing that I was giving my life to the thing that was most relevant at this moment.
He's since received both doses without complications, but admits there was trepidation when heading to his first appointment.
These things are real. If I didn't believe them, it wouldn't mean that they didn't happen. But yes, there was trepidation. But in my mind, I was trying to be courageous.
Morris received her first dose of the vaccine a few weeks ago as well. She too was hesitant and wanted to read up on the clinical trial research before committing. All agree vaccine access, when supplies do increase, dispelling misinformation and quelling anxiety are important steps. Gillespie says individual conversations with friends, neighbors, and family members who have already received the vaccine go a long way in removing fear.
However many different people we need to bring together in a collective to talk about this and to work through the fear and the anxiety, we're going to do it.
Morris says the anxiety she felt receiving her first shot is gone. She's now adjusting her focus on getting others in her circle and community vaccinated.
I don't have that anxiety. It's behind me right now. I know I have that second dose coming up, but it's going to be okay.
Her hardest sell might be her 85-year-old father, but Morris isn't going to stop trying.
He is a work in progress, okay?
For Indiana Newsdesk, I'm Brock Turner.
Well, the COVID-19 pandemic is driving up the demand for used cars around Indiana. Part of the reason is fewer new cars are being manufactured. Adam Pinsker reports.
It looks and feels like another day in the office at Hubler Honda of Columbus. The showroom may look a little empty, though, because of the COVID-19 pandemic, but there is plenty of demand for used cars.
If you wanted to trade in a used car, now's the time to do it because it's worth more than it'll ever be worth.
Used car sales manager David Kapitsky says inventory of used cars at his dealership increased shortly after Hubler opened this dealership last July during the pandemic.
We're lucky that we get lease turn-ins from Honda people that lease the vehicle, turn them in here, and they're usually in really good shape, and the residual value is what it's worth after the lease is usually less than what it's worth.
Another factor fueling the used car craze is the lack of new vehicles in stock. Several vehicle manufacturing plants around Indiana shut down last spring during the height of the pandemic. Some, including the GM plant in Kokomo, were converted into assembly lines for ventilators.
The new car inventory got really, really low. People still wanted to buy cars, needed to buy cars, and so they ended up buying used cars.
Wayne Leach is the used car sales manager at Ray Skillman in Greenwood. His dealership is also seeing a jolt in used car sales during the pandemic.
A little bit of everything. It seems like trucks have been very popular.
According to Edmunds.com, which is an online resource for automotive information, interest rates last June were at 7.8% compared to 8.6% in June of 2019. So financing a used vehicle got even cheaper.
It was the best year we ever had last year.
Kapitsky says the pandemic also brought about a change in driving habits that's reflected in the increased sales.
I do know that more people have bought cars because they don't want to ride with somebody or they don't want to get on a bus with a bunch of people.
As car manufacturing facilities adjusted to life during the pandemic, production of new vehicles at Subaru of Indiana's Lafayette plant has returned to full production. Honda says sales of its CR-V and CR-V hybrid made at the Edinburgh plant are strong, and the facility is fully operational. According to Edmunds, those same low interest rates are also starting to fuel a buying frenzy with new cars. Forecasts show an increase in new car sales of 6.5% from 2020 to 2021, so more choices for consumers equals better prices.
It's always a good time to buy a new car. I mean, they got rebates and everything going, but now the used cars are coming back down on price, so there are good deals on used cars also.
For Indiana Newsdesk, I'm Adam Pinsker.
Coming up next on Indiana Newsdesk. Indiana legislators are debating a bill that would no longer require Hoosiers to get a handgun license. Ahead, the status of that bill and other bills progressing through committees at the State House. And with Valentine's Day approaching, we take a look at more than century-old confectionery store in downtown Jeffersonville that's preparing for its biggest day of the year. These stories and more right here on Indiana Newsdesk.
Stay close to Indiana Newsdesk as we trace education issues all the way from the Capitol to your child's classroom. So many topics that arise each year in the State House affect what happens every day in the schoolhouse. The WTIU News Team is committed to helping you stay up to date with the issues that affect your family's future. Keep yourself informed. Tune in to Indiana Newsdesk, your source for regional and state in-depth news.
The COVID-19 vaccine is here. It's safe, effective, and it's our shot, Hoosiers. Seniors, long-term care residents, healthcare workers, and first responders are now eligible. If you or someone you know qualifies, go to ourshot.in.gov, or for seniors, call 211 to learn how you can receive the vaccine. But remember, we need to keep wearing masks and following other protective measures to keep everyone safe. Because it's our shot, Hoosiers. Sponsored by the Indiana Department of Health, aired in cooperation with this station.
Welcome back to Indiana Newsdesk. Well, homicides in Bloomington jumped in 2020 despite an overall decrease in crime. That's according to the City of Bloomington's Public Safety Director's annual report. The report showed that homicides rose by 150% after 5 homicides were reported in 2020. There were just 2 in 2019. Other major crimes such as aggravated assault, kidnapping, sex offenses, and simple assault all showed lower numbers. There was 1 report of human trafficking, the same as 2019. Bloomington Police Chief Mike Dekoff attributed the decrease in aggravated assaults to the reduction of students in Bloomington and particularly at bars amid the pandemic. One Indiana House committee is debating a bill that would drop the license requirement to get a handgun. As Indiana Public Broadcasting's Brandon Smith reports, Indiana law enforcement groups are on both sides of the issue.
The process to get a handgun license typically takes just a few days, though during the COVID-19 pandemic, it's taken much longer, as much as a few months. Indiana State Police Superintendent Doug Carter says the burden of waiting to legally carry a handgun in public is outweighed by the importance of those licenses to police.
Your kids and mine in your communities, please don't put them in jeopardy.
Hamilton County Sheriff Dennis Quakenbush says nothing should get in the way of individual citizens defending themselves.
The government should not be your plan A for protection or self-defense. The government is not our savior.
Brandon Smith now joins us for more from Indianapolis. Hi, Brandon. What's next for this bill?
Well, the bill has to pass committee. That was just a hearing this week. And just to make something clear, the current requirement in Indiana is that you have to get a license to carry a gun in public. If you want to get a handgun right now and you're of age and a proper person, you can do that, but only keep it in your home. We'll see. There is a committee hearing scheduled on Monday. There won't be testimony likely taken. It should be just amendments by the members of the committee and a vote on the bill. We'll see what it looks like when it comes out of that committee, if it does, on Monday.
The General Assembly is hitting the halfway mark of this legislative session, so we'll do a quick update since we have you. The House Republican budget prioritizes increases for school vouchers and virtual schools. What does that mean for public education? What are some of the other budget priorities too?
Well, for public education, they would get less money under the House Republican budget than Governor Holcomb proposed in his, in terms of an increased funding, which has long been an issue of friction between school choice advocates and traditional public school advocates in the state. Although this would be the biggest expansion of vouchers that we've seen in some time. But that has a long way to go, as it first has to get out of the House, then go to the Senate, and we'll see what it looks like at the end of session, which is still months away. In terms of budget priorities, the House Republicans are prioritizing spending one-time dollars out of budget reserves in a very different way than the governor proposed. The governor wanted to spend $700 million this year paying down state debt. Instead, House Republicans propose several one-time programs, grants to help kids recover from learning loss during the pandemic, small business restart program to help businesses that struggled during the pandemic, as well as new facilities at the Indiana Law Enforcement Academy, which trains most of the police in Indiana.
The chairman of the Environmental Affairs Committee said he wouldn't hold hearings on any bills before the committee. Is that common for committees, and what are some of the issues that aren't being heard?
It's a little unusual, certainly. This is the House Environmental Affairs Committee, and one thing that the chairman did say is that there were some bills in the House that are duplicates of bills in the Senate, and those Senate bills are on their way over to the House. So we will see committee hearings in the House Environmental Affairs Committee in the second half of the session. But he also said there were a couple of issues like lead pipes and others that the federal EPA is taking a look at, and he wants to see what they'll do before the state takes any action.
The House easily passed a bill that would somewhat tie the governor's hands in emergency situations. What are some of the consequences of that, and any indication it will pass the Senate?
I do think it'll pass the Senate for sure. It'll be interesting to see if they add more things in or not. What the House bill does is it allows the General Assembly to call itself into a session, which they are not allowed to do under current law or the Indiana Constitution, if the governor declares an emergency like he did during the COVID-19 pandemic. So they could potentially, well, quite frankly, stop the governor from doing a lot of the things he did during COVID-19. It also says, going forward, the governor and local governments, for that matter, cannot issue any restrictions on people worshiping at church, which the governor has done. First, early in the pandemic, he shut down churches along with a lot of other public places in the earliest days of the pandemic, and then he required social distancing and mask wearing and that sort of thing. The General Assembly's bill says he could no longer do that, or any governor could do that in the future. We'll see what it looks like when it comes out of the Senate.
All right, Brandon, thank you very much.
Thank you, Joe.
Well, Columbus is hoping Blooming Foods will come to the city's downtown. The city's need for an urban grocer was identified a couple years ago in a planning process called Envision Columbus. The city is working with developer Flattery & Collins to build a $39 million mixed-use building with 200 apartments, parking, and retail space.
They represent a little bit different slice of the market than, say, a Kroger or a Walmart. And I think that would be well received here in Columbus. Plus, it would provide healthy choices for those people who live within walking distance.
The location just east of the county jail is vacant. Most of the land was given to the city by Irwin Sweeney Miller interests. Blooming Foods officials say they've been in conversations on the new project for about a year, but still have more work to do.
We're in pretty good state. We're in a strong position to be able to even take a look at opportunities like this and consider them.
Blewett says the co-op is coming out of the pandemic stronger than it was heading into it. He says the store has less traffic, but shoppers are buying more. Construction on the project won't start before March of next year. A more than century-old covered bridge in Greene County is temporarily closed after a suspected arson fire last weekend. Holden Abshir reports.
The Richland Plummer Covered Bridge sits about 2 miles south of Bloomfield on South Baseline Road. At 102 feet long, the Burr-Arch Truss Bridge is the only one of its kind in Greene County. Visitors travel far to see the white one-lane bridge spanning Richland Creek every year. Many locals use it every day.
There are several residents in this area that take a lot of pride in this, and they come down and they routinely pick up the trash. They keep me very well informed about any problems with the bridge.
Originally opened in 1883, Richland Plummer was one of 58 bridges built in the late 19th and early 20th centuries by Hoosier carpenter A.M. Kennedy and Sons. Today, nearly 75% of the Kennedy's bridges have been destroyed, several the victim of arson. The Greene County Bridge almost joined that list on Sunday morning. However, the fire damage is minimal.
We have had some damage to the bridge through vandalism with the siding and things like that. I mean, knocking the siding off and things like that, but never anything to this degree.
Taylor Fire Rescue extinguished a structural beam fire just before 10 a.m. Officials found matches in a container of gasoline on the bridge. The Indiana State Fire Marshal is conducting a full arson investigation. The fire did not spread far beyond one individual beam on the structure's north side, but officials are unsure exactly how long it burned.
It's very hard to start a fire with that type of wood. So I think the fire burnt a long time before it was anybody ever found it.
The bridge will remain closed until the damage can be assessed and repaired by an engineer. For Indiana Newsdesk, I'm Holden Abshir.
And Sunday is Valentine's Day, and that has the candy store in Jeffersonville preparing for its biggest day of the year. Lily St. Angelo reports.
As Valentine's Day approaches, this 130-year-old candy store has been busy.
We're making red hot hearts today.
Schimpf's Confectionery in Jeffersonville, Indiana is run by Jill and Warren Schimpf, fourth-generation candy makers with a passion for handmade sweets. Christmas is their biggest season, Easter their biggest week, and Valentine's Day their biggest day.
Valentine's Day seems to be the biggest because, men, they wait till the last moment and they all come in saying, just give me something that looks pretty.
Last spring, they had to sell Easter candy for 75% off as the pandemic hit. Although sales have bounced back, they are not up to pre-pandemic levels. But the family-owned candy business has survived rocky times before, including the 1918 pandemic, the Ohio River flood of 1937, wars, and the Depression.
We've suffered a lot, but we've had a lot of fun as we went along.
Warren and Jill lived in California before taking over the family shop 31 years ago. Warren, a chemist by training, analyzed the quality of drinking water for Southern California for 20 years, and Jill was an English as a second language teacher at Claremont McKenna College. They've always loved candy. They fundraised for the International Student Center where Jill worked by making candy in their garage. Many of Jill's international students learned to make candy with them. Schimpf specializes in hard candy and hand-dipped chocolates. Their hard candy is made on equipment from when the shop opened in 1891. Warren says one of the best things about making candy is the instant feedback he gets from customers.
I say this facetiously, but sometimes they come back and say, "Damn, that's good." And, that kind of feedback from the customer not every job gives you that feedback.
In normal times, Jill herds groups of children and adults through the store, demonstrating the process and teaching them shop history. Even though tours are now closed to large groups, they still do small private tours for families. For Warren and Jill, carrying on the tradition for local families is one of the most satisfying parts of their work.
It's the repeat customers, the community people, people that have been coming here for years. People that came here as children with their grandmother, great-grandmother, and now are bringing their. So that's the fun of it.
The Shimps are famous for their cinnamon red hots, chocolate pecan turtles, and caramel-covered marshmallows. Customers can buy pre-packed Valentine's Day boxes or fill their own boxes with whatever their hearts desire.
320 degrees.
For Indiana Newsdesk, I'm Lily St. Angelo.
30 pounds of candy.
And our work continues online as we cover the news throughout the week at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. Maller Grodner Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.